Hello, my name is Maria Oliveira. I'm from Group 15 and I'm here to talk about electrical scalpels. So, we all know what a traditional scalpel is. It's a surgical knife that has a sharp edge and it's used for surgery to cut tissues in general. But I will talk about electrical scalpels that were invented by William T. Bovey, who was a biophysics scientist, and he originally invented an electrical surgical generator, but it soon evolved to the electrical scalpel as we know today. And so the instrument can be called Bovey or ESU, electrical surgical unit, and it's an instrument that has a needle-like, which is a very small and very thin tip, and it's used to cut tissue while at the same time it sterilizes the edges and seals the blood vessels that were damaged. And this way it can prevent blood loss during surgery. And so what is happening during the process is that electric current is passing through the blade, and so the tissue can be cut more easily. These types of instruments are usually used in electrosurgery. And why do we use them? Mainly because we all know that neural and muscle cells can be stimulated and excited by electric current, and in human patients that can cause pain and muscle spasms. And so to prevent this, we usually increase frequency. And what happens in electrosurgery is we use radio frequency that ranges between 100 kilohertz to 5 megahertz, which is a pretty high frequency itself. Um, Radio frequency electrosurgery is used in all surgical fields, including dermatological, gynecological, cardiac surgery, plastic, eye surgery, and many more. And so, how does it work? It's probably easier if you look at the image. So, you can see here a generator. And what happens is this generator will transmit electric current to the active electrode. And we know an electrode is a device that provides current to a non-metal object, this being the tissue of the patient. And so the active electrode transfers the electricity to the tissue of the patient, and this will transfer it again to the grounding or returning pad that needs to be attached to the patient, and this one returns back the current to the generator. And so we can say this is a closed circuit because we have one flow movement of electric current. And so the type of electrosurgery that I was talking about before is monopolar because we can have two types of electrosurgery, monopolar and bipolar. And in monopolar electrosurgery, what happens is the electric current goes in one direction. So as we saw before, it goes from the generator to the active electrode, to the tissue, to the pad that is attached to the patient, and then again to the generator. So one cyclic flow, one direction of the electric currents. Then we have bipolar electrosurgery, which uses lower voltages, so less energy. And what we have is an instrument that has two tips or two ends. And this means that the instrument itself already has The active electrode usually is the top end, and the dispersive electrode, which was represented by the pad in the previous type of electrosurgery. And so the radio frequency electric current is only working between the two ends of the instrument. This is better used in procedures where the tissue can't fit and can be grabbed by the instrument, which so between the two tips of the instrument. And it's very used and extremely used in procedures where we have patients with implanted devices. This because this type of electric current prevents it to spread to other parts or to damage other parts of the body, and so it doesn't interfere with the devices that are implanted in the patients. And so both of these types of electrosurgery, monopolar or bipolar, are extremely used nowadays, especially because of the advantages that it prevents the blood loss, because many procedures or many surgeries have the risk of extreme blood loss and a lot of consequences due to that blood loss. And, and so these instruments can be a great advantage to those type of procedures. And that's it. Thank you.